Good afternoon. My name is Brad Geyer, and I am here with the FormerFedsGroup Freedom Foundation with Carolyn Blakeman, also known as Cece, also known as American Granddaughter. And with us are Joey and Pam, who are from the healthcare industry. They originate from the great state of Georgia. And we, of course, are here today to discuss treatment protocols for COVID-19 and specifically the continued use of a drug known as remdesivir, also known as Veklury. Joey and Pam, thank you for being here today.
Thanks, Brad. I appreciate the time and the information. I hope is going to be used. The information that I voice, I hope, is used to benefit everybody. Everybody. I guess this is a worldwide pandemic, so everybody needs to, I think, hear a little bit about, everybody's input. So, to start off with, I was diagnosed the latter part of July, and about a week later, I've been home out of work and started to develop problems with breathing more and more. And my oxygen saturation was going down over that time period as well. And my wife and I came to the conclusion or decision that I should probably go on into the hospital to, start other treatments.
At that point in time, though, I'm going to interject. We are not ones being in the healthcare industry to go to the hospital lightly. My daughter will tell you when we go to the hospital, we stay, we don't come home. So all of us knew when he left that he was not going to be home for, I did not think it was going to be the 3 weeks that it was, but we didn't think he'd be home for a couple of days. He was sat in the 80s at home. And really, the only reason we decided to send him was not really for the medicinal purposes. It was because we don't have oxygen at home. He needed oxygen supplementation. I couldn't get that at home. As far as the other protocols and treatments, those weren't even on our mind at that point in time. It was really just for oxygen supplementation.
So about the 7th of August, I went on into the hospital via ambulance because we knew that my wife wasn't going to be allowed into the hospital because of the
visitation policies that are still in effect that isolate family members.
Right. So I went in there and patients were throughout the emergency room everywhere. They had me in the hallway for a little while. A lot of patients were in the hallway. All the rooms were filled. And it was probably one of the heights of the pandemic at the time. And
the Delta variant.
Yeah, the Delta variant, so they say. And so I finally got into a room and they gave me some monoclonal antibodies right off the bat. And unfortunately, it all ended up on the floor. I don't know what happened or what tube wasn't tightened down or what have you, but I looked down underneath my bed and I told the nurse, hey, there's all my medicine right there on the floor. And they saw that, they recognized it, and they did give me another a round of monoclonal antibodies. Did it help? I have no idea. I don't think it did. Anyway, so they give me up to my room and
now let me back up the story a little bit. We sent him in on a Saturday. He left the driveway at about 1 o'clock in the afternoon. I never got a call from the hospital saying he had arrived. I never got a call from the hospital saying consent for treatment. I sent him with his wallet, with his ID, an emergency credit card, his glasses, his cell phone, and a charger. That was the 5 things he took to the hospital. So we are all sitting around. And honestly, the only reason I got any communication from anybody is because both of us, like I said, we are both nurses, and he knew what was going on. He could communicate it to me. I understood the lingo. So here we are. Now, again, like I've been saying to you, Brad and Cece, from a layperson's perspective, they would have no clue what's going on. I, for all intents and purposes, have heard from nobody. And he's on oxygen, and he actually told me at one point in time, he told me Saturday night, this is like 9 o'clock Saturday night. So it's like 8 hours after he left. He goes, hey, they tell me I'm going home. I'm on oxygen. And he said, I'm in respiratory acidosis, which if you look that up, as being a prior ICU nurse, like nobody goes home with that diagnosis. So I was about bewildered. And I said to him, I said, they're sending you home? He said, yeah, they said it'll autocorrect at home. So I'm like, okay, well, just tell me when I need to pick you up. Like, I don't know what's going on. So this is like 9 o'clock at night. He goes to sleep. I go to sleep. And so the next morning rolls around, and I texted him. I'm like, what's going on? It's like 9 o'clock in the morning now. I've heard nothing. And he goes, I don't know. I think I'm still supposed to be going home. And I said, well, I need to know at this point in time. So I end up calling and talking to his nurse. And again, I want to give the perspective. I don't want to ding the healthcare industry, but I want people to understand what's going on. Joey just told you what the ER looked like. I call his nurse, and I said to him, I finally got a hold of her, and I said, hey, my husband is so-and-so, and I just need to know what's going on. Do I need to come get him? What's the deal? And she's like, I don't know. I haven't even seen him. And I'm like, okay, this is 9 o'clock in the morning. This is 2 hours after your shift has started. So my point in this is, again, the overwhelming stress this is putting on, the healthcare industry, not all the time, but definitely during peak times. That is probably not an uncommon factor in this. So when family members don't hear from their nurses and don't hear from their doctors, it is not because they don't want to, it's because they are overwhelmed. And I think that's what was going on at this particular time. Again, this was August in Georgia and Florida and the Southeast when the Delta variant was at its peak. So bottom line, we found out that he actually was being admitted. So he gets admitted, and I'll let him finish the rest.
So yeah,
On this day, can you estimate how many days prior to admission you'd contracted COVID-19? And if you know, at what point around that time that you contracted it, did Pam contract it?
So he actually has a positive COVID test the 26th of July. He actually contracted it probably the day or two before he actually took the test. And I'll be honest with you, Brad, I have no idea when I had COVID. So I never have had a positive test. I have had a positive antibody test, so I know I did have it. When back in June, I got pretty sick. Like I had a headache, I had a stuffy nose, I had a fever. Being the nurse in me, I'm like, I didn't even think about getting tested for COVID. Bottom line, I ended up testing positive for COVID on one of those little home rapid COVID antibody tests that you can buy at Sam's. Do I have a documented positive COVID test from then? No, I don't. Now, when he got sick, the only thing I had at that point in time, I had a little bit of a scratchy throat and I lost my smell. I never lost my taste, but I never ran a fever. I never felt bad. I lost my smell and I had a sore throat.
Were you guys on supplements? Were you taking it like vitamin D, anything like that? Prophylaxis or just for general health?
He was not, which interesting. He was not. I don't know why he wasn't, because they've always been in the house. I've been on supplements for probably about 2 years. And well, even before that, before COVID, probably a year before COVID came out. So like 2018, I started like a multivitamin and all that kind of stuff. When COVID came out, I hyped up my vitamin C, my zinc, and my vitamin C. So I was on high doses of vitamin D, but nobody really else in the family was. So, and I will tell you, when he got sick, he was diagnosed the 26th of July, went into the hospital the 7th of August. My kids got sick, and we never got them tested, but it's not a rocket science. His dad has COVID, they've got COVID too. They were sick my 13-year-old was sick for a day, and my 20-year-old was sick for about 3 days.
so okay, so they finally decided to go ahead and admit me, and the doctor came in. I saw her that morning, and she basically told me was that, yeah, we're going to go ahead and start some remdesivir on you and start you on a steroid for 10 days. And the remdesivir was a 5-day run. And we started the remdesivir, and it went in okay. I didn't have any issues with the medicine after the first dose or so. But I will tell you, after the second and going into the third dose, my sats start dropping. I mean, I went from just on a simple mask, simple Venturi mask that was producing like whatever 6 meters. I went from that to a high flow nasal cannula and a non-rebreather combined on its maximum output to maintain a 90% oxygen saturation. And even that was difficult to maintain. I was probably in the higher 80s with the high flow nasal cannula and the non-rebreather on at the same time.
August 8th, right? August 8th, you started it?
Yeah.
It's August 7th or 8th. And I
The day
can also,
after you got in,
yeah, the day after he got admitted.
get it in there fast, yeah.
From the outsider, like he's telling you from the insider's perspective, from the outsider's perspective, I can tell you he got his dose of remdesivir in the evening. And I know that for a fact. Since then, we've gotten his medical records and we've confirmed that. But I would talk to him in the morning and he would be like, that morning I talked to him before his first dose, he was just on a simple nasal cannula like you see him on now. He got his dose of remdesivir. That next morning, he was on a face mask. His second dose of remdesivir, he was on a non-rebreather. His third dose of remdesivir, he went to a high flow nasal cannula. His fourth dose of remdesivir and fifth dose of remdesivir, he went from a high flow nasal cannula, increasing all the way up to the maximum concentration that they could give him oxygen with a non-rebreather on top of it. So it was like I would talk to him during the day and he'd be fine. He'd get his remdesivir. I'd talk to him the next day and he's on more oxygen and he's just slowly declining.
I don't understand why they keep going if they see it's declining.
Yeah, it didn't make
if somebody
sense.
say this isn't working, he's getting worse.
Mhm.
They just think
My lab work was also going down. She was able to watch my labs via the network the hospital has, and she could see that my lab work was getting worse. And
Like on a day-to-day basis even?
Yes, I would check it every single day. He would have labs drawn every single day. I could see his labs and I could see his physician notes. And I'm telling you, I would log on to that system.
Give us an example for, like, I'm not a medical guy at all, but give us an example of what you're seeing.
Seeing his liver function test, he went in with normal liver function test, his metabolic panel basically that tells all of his electrolytes, his kidney function, his liver function, all of that. When he went in there, it's essentially normal. Now his D-dimer, which is indicative of a clotting issues, his D-dimer was elevated, and his D-dimer over the course of this remdesivir and the course of his disease process, it went sky high. It hit almost 2,000, which is enormously. Wow. It did obviously go back down, but I saw his kidney functions, he's going into kidney failure. His liver functions were sky high. His metabolism, his electrolytes were all like, his potassium was off, his magnesium was off, his sodium was low, his
GFR.
Right, his protein levels, his GFR, I don't remember what his GFR was, but everything was just, it was all out of whack.
Because it says in the EUA, if your GFR gets under 30, then you know,
I'll have to look. I have his medical records. We can look and let you know. But the other thing, like his protein, you know, this was a guy that every morning he would have to be at work at 8. He was out of the house by 5 in the morning, and from 5:30 to 7:30, he was working out in the gym. So I'm looking at this, and his protein levels are just like he's wasting away, is what I'm seeing.
And no one said stop.
No one said stop. Everybody said you got 5 days. You get 5 days. And like I said, my research, having been the one that was kind of gearing up for all of this, my research had been on prevention and early treatment, never thinking that any of us would go into the hospital. So as far as I knew monoclonal antibodies, and I was all gung-ho for them if we needed them, but the remdesivir, I never did any kind of research into it. I never, you know, and I know that sounds kind of neglectful or whatever on my part, but I didn't ever think we would need it. Like, I did never go to that. And my specialty right now is not, I don't work in the ICU anymore, so I don't see the remdesivir being given on a daily basis like I did in critical care.
Crazy.
This is
So,
fascinating. Thank you so much. Keep on going. I'm literally on the edge of my seat.
Me too. I'm just like writing like a.
so it was about the 5th day. My wife and I are talking on the phone, and I'm struggling, you know, and I will tell you though, it was my goal to get out of the hospital, and that was, I was going to try and convince the doctor anytime they came in, or any nurse that would come in and ask me questions, how are you doing? I'm good, I'm good, I'm good. I'm maintaining my sets. And I'm intentionally doing everything I can to establish an elevation in my saturation, in my bloodstream. And sometimes that, a lot of the time that was a challenge, but I would do it and I would focus on that. And it was just a fight that I had to make sure I keep my sats up. And so whenever the doctor would come in, I would always, you know, try to convey the message that I was getting better. I feel better. But in retrospect, I knew, and they could tell, you know, if you're not doing better, they could tell physiologically by your lab work or your radiology reports, and just they would combine all this together and say, well, you're really not. You know, you say that you are, but you know, if you say one thing and then your report shows something else, then there's a conflict of a dilemma. For the most part. Anyway, they would go back and they would write in their notes indicating that this patient reports that he's feeling better. So, and my intention for that was to get me out of here. I need to get out of the hospital. I'll feel better once I get out of the hospital. And well, and make a long story short, that never happened. I never got out of the hospital when I would love to get out of the hospital. But anyway, we finished a 5-day run of remdesivir. And my wife says to me, well, why are they stopping you? They could do another round of remdesivir. And we didn't, like she was saying, we didn't know, we didn't understand the physiological workings of the remdesivir on the body. So she wasn't telling me, you know, call the doctor or get with the doctor, find out why are they doing this? Why are they stopping the remdesivir? Find out about why your protein levels are dropping so low. Why is your calcium so low? Why is your D-dimer going back up? So she's seeing these labs and I'm reporting off to the doctor. And like I've told you, I think before, that the doctors don't stay in your room for very long, less than 5 minutes at most. And I mean, I can honestly understand why to a certain extent, but please answer your patient's questions, because that is very important for your patient to understand everything that they can understand. And especially at the layman's term, they can tell me that because of what I do and what my wife does. But for the layman's person, they don't understand all that talk. So, but after the first 5 days, I had a bunch of questions of why I wasn't continuing on remdesivir. I continued on the steroid, but not the remdesivir.
And I will tell you, at this point in time, he's had his 5 days of remdesivir. He's been in the hospital almost a week at this point. All I see is deterioration, not only in his medical record, like on paper, but I can hear it. Of course, you know, they're not letting me in. They're isolating the family members, and I can hear it in him. Like, I can hear it when we talk on the phone. I can see it in the wording of his texts. And I think I told you guys when we met last that Joey, he was taken to the hospital that I work at. So I didn't have access to him. I didn't go see him. I followed hospital protocols, but the one advantage of me being in the hospital that he worked at, it ended up being many advantages, but at this point in time, the advantage was I had a network of friends, very supportive nurses that we've just developed a friendship with, who could see in me that he was not doing well. And they pulled every favor in the book, they pulled out all the stops. And on that Friday, on his last day of remdesivir, they pulled the strings and I got 10 minutes to go see him. So I got a 10-minute visit with him. I had to wear all the gear, all the garb, like I said, even though a week before I'm in the same house, in the same bed, but for fear that I followed the rules. They gave me 10 minutes. I wasn't going to buck the system at this point in time. That 10 minutes gave him the surge to fight. I went in there. He didn't even recognize me because I've got my hat on, I've got glasses on, I've got a mask on. I mean, you name it, I've got every body part covered. And I finally lifted my glasses up and you could see the elation in his face. I mean, he just started to cry. I started to cry. We FaceTimed our kids. That 10 minutes invigorated him, I think, to fight until Monday rolled around. And Monday was another critical part of his course of treatment and remdesivir survival. But that alone, that 10 minutes, if every family member would be given, if every patient would be given 10 minutes every other day, I think you'd see a drastic decline in the comorbidities, in the death rate, the
Elected
morbidity.
representatives, elected representatives in Congress, the White House, the administration, public health agencies, hospital administration, physicians. Please, if you didn't hear what she just said, please rewind 1 minute and listen to what she has to say again. 10 minutes change the day.
I have to
Thank
tell
you.
you,
10 minutes changed the difference between life and death.
after
I
you,
honestly will tell you, if I had not seen him
yeah,
and he had not seen me, I wouldn't have done what I did and he wouldn't have fought like he did.
I
Did you feel like you were in the process of giving up? Did that cross your mind? Explain that psychological condition you were in at that point. I'm sorry, Cece, for interrupting.
okay.
So basically, when you're on your deathbed, you're starting to run a lot of things through your head. And it's a thought process where the end is now. And man, it's hard to explain. Let me just say it like that. I can't, other than just knowing that if I don't continue to fight, if I let go, that's it. And that's fact. And I will tell you, they gave me this little plastic toy. We call it an inspirometer. This inspirometer helps you open up your lung cavity, your chest. It helps you open up your lungs so that your alveoli can do the work that it needs to do for the oxygen carbon dioxide transfer. And so I was using this inspirometer quite often. And as the days would click by, I noticed that my volume, my inspirometry volume, is getting less and less and less. And I am doing everything I can to pull in as much volume of oxygen or air into my chest that I can, but I can't do it. I can't, it's getting worse. And I could see it. I got down to around 900 about the day 4.
And you
time
started
frame.
at what, 15 or 18?
And I started about 1500 and I could only get up to about 900. Well, I'm going to jump ahead just a moment. After the remdesivir was finished and Pam got me started on some ivermectin and a bunch of the vitamins that she was identifying. It was probably that afternoon, after I took that dose of ivermectin, that I started actually feeling better and I could breathe better. And it was measurably different from 900 on the inspirometry, I'm going back up to 1400 on my inspirometry, and it was going that quick. And I will also tell you, I think I think what really helped me was that I was peeing a lot more. And I mean, I couldn't keep the urinal empty. And once I finished that remdesivir, I mean, it just felt like I was peeing every 2 to 4 hours, and I would have urinals beside me. And at one time they had 2 or 3 of them in there because I was peeing off all that fluid.
So
Right.
he was lucky enough as soon as he got off the remdesivir, even though his kidney function, his labs were all out of whack, his kidneys did not suffer any damage. That as soon as that remdesivir stopped, bam, his kidneys started functioning again like they were supposed to. So when they tell you, I mean, for all intents and purposes, there's no better words. When people are drowning, that's kind of what they're doing. Their kidneys are shutting down, so they're retaining all this fluid. He got off that remdesivir, and that fluid just started coming off. So, and I will tell you that Friday when he talks about, just to kind of back up and give everybody a timeline, when I saw him that Friday and saw the change from when we sent him in that Saturday to now it's a week later that Friday that I saw him, the change in him in that less than a week invigorated me to go home. After that, I was working that day. I got off that night. That Saturday and that Sunday, I got on the computer and I researched and I read and I looked up and I found, and somehow or another, I found that FLCC website and went to their hospital protocol. And I visited every health food store, every drugstore, every Walmart, every Publix, all the pharmacy sections, and all the things that I could get on their list that was over the counter, I got. All the things that I got on their list that were prescriptions that I had on hand, I got. All the things that were prescription that I knew I didn't have on hand, that's when I started calling in favors, and I got as much as I could. So when he tells you that we started sneaking in drugs, I bought a 7-day pill case, Monday, Sunday through Saturday. It had 4 little divisions in each. He got ivermectin, he got zinc, he got vitamin C, he got Pepsid, he got, I mean, everything on that website. His vitamin D, I mean, I think he probably had low vitamin D, but I think the combination of the vitamin D, the ivermectin, and maybe the vitamin C, because I had him on high doses of all of that. I snuck that into him Monday. I put it in a bag. Again, I can't see him now. Now, hospital protocol was 30 days from the time of 21 days, excuse me, from the time of diagnosis, you were allowed to have visitors. So I saw him that Friday and he was allowed to have visitors the following Wednesday. So on Monday, I walked up to the hospital, to the unit, and I brought him a stack of books. And in that stack of books was the medicine. And I told him, I said, you start taking it. It's in the stack of books. Don't let anybody see you take it. Because again, I've told you before, like he kind of had to be sneaky too, because they've got those cameras on everybody. So he's sneaking meds that I'm sneaking into him and not being caught. And that started on Monday, and I got to see him on Wednesday. Now that was 5 or 6 days. I got to visit him on Wednesday. From that Friday to that Wednesday, it went from a debilitating, degenerating man to an invigorated, excited, get me more meds man.
Yeah.
I have to say, after hearing y'all's story, just a little bit of it on last Monday, it inspired me, and I wrote a blog and dedicated it to you guys. And it's called The Magic Medicine of Love. And I studied psychology in college, and my grandfather used to say, the strongest muscle in your body is your mind. And if you want to, you can beat anything if you just use your mind to do it. And he beat cancer. He had 3 heart attacks. He was shot down in World War II. He survived all of them because he said, I'm always going to go home to my family. I think there's just something very powerful about having that person in there just for 10 minutes, saying, fight, come home. I love you. I need you. And so many patients are dying because they're alone and they don't have that, they just kind of, their body just gives up. But that is something that has got to change, because you're not even contagious by this point. And even if you were, 99% of the people survive it. And I don't care. Give me COVID. Let me go see my husband. You know what I mean? I'll take that risk. I'm on prevention and I know what works. So I'll email you the article, but it has your story pretty much in it. I didn't use your names, but
you can, like I tell people, use our
dedicated
name.
to Joey and Pam under the title, but
I will tell you that when we started visiting on that Wednesday, we made a pact as a family. So I have 2 kids that are old enough to drive, and then we have a 13-year-old. We made a pact. On the days that I worked, one of the kids would come and visit, and on the days that I didn't work, I would come and visit. And those visits, as short as they were, I mean, they were a couple hours a day. He lived for those visits.
yeah.
It didn't matter who was coming, what time they were coming, what we were doing. That's what got him through the rest of the days, I think. That's what got us through the rest of the days. Because we would come home and that's all we would talk about, our visit with Dad. And I even, again, here I am sneaking meds into my husband. My 13-year-old, the hospital visitation policy for COVID patients is 16. I coached him and coached him. My 13-year-old's 6 foot tall. So he can pass for a little bit older, but I coached him and coached him and coached him and coached him on his new birthday. So when he went to Dad, he was 6.
It's cruel.
I'm pretty sure there's going to be elected officials in Congress and state officials that are going to be watching this.
Yeah.
Imagine having to smuggle in medications to save the life of your loved one in an American hospital.
Most of which, Brad, I will tell you, were over-the-counter medicines. The exception of the ivermectin, most of them were over-the-counter meds.
Which is over the counter in a lot of countries, except here.
Right.
So it's not that dangerous. And a lot of them, the African countries, they think it's so safe that they'll let non-medical people distribute it, to their town, because they're not worried that it's going to do anything.
We heard on, I think it was on Joe Rogan, he had a physician on, and they said that there were 200 members of Congress. I believe it was over 200 members of Congress that had been treated with ivermectin kind of on the down low. And I'm just going to throw it out there to our members of Congress. You guys really are under an obligation to do something about this and correct this. This is a national scandal of historic proportions, and future generations are going to look back at how you responded to this information. You have 2 deeply experienced healthcare workers, both nurses, and look at the gymnastics that they had to go through to have Joey survive. It's totally inappropriate.
It's unacceptable.
Let me add, Brad, because I know Joey won't do this. He's a little bit humble. He has spent 32 years as a government employee. He was 22 years active duty, and he's been 10 years civil service. So you've got a guy who's dedicated his entire life, essentially, to defending our nation and representing our country.
It's a lot to have to absorb that this has happened to the country and that so much of it is self-inflicted. And there'll be investigations about this both in Congress and by our civil enforcement authorities. But it's just inconceivable to me. So, and the thing that really is interesting to me is that you actually your status quo thinking had to be focused on breathing and doing the right thing, like almost concentrating on living, essentially. And you had to maintain your mental focus in doing that, and seeing your wife for those 10 minutes, even through all the hazmat suits, helped you with that.
So yeah, I mean, those are, for me, my battle was simple. All I had to do was focus on breathing. My wife did all the legwork on this. I didn't have to do anything except for what she told me to do and for what she told me to take.
Isn't that typical?
So I followed.
Join the club, Joey. I got news for you.
You're doing that right now, right?
You know,
We're
we
here.
would, when we would call in the morning, most of the time I would call him. And I don't know why that was. I think it was just because I would get worried because I hadn't heard from him. And Brad, you said that all he had to do was breathe. And that's exactly how I would start our conversations. He would pick up the phone and you could hear the oxygen in the background roaring into his mouth and nose. And he would say hello. And I'd say, hey, I know you can't talk. I know it's too taxing. I just have a bunch of stuff I want to tell you. You just sit and listen. And that was literally what I told him to do. I mean, we've had lengthy conversations about how I just told him, just breathe. And every day I would log on. And that's kind of what I want to stress to people. You know, our story is unique in that I don't think the layperson, and I wish there's a role for him and I in all of this, I do believe, and I don't know where that's going to lead to, but you know, like I said, I would log on to his chart every single day and I would look and I'd be like, okay, his sodium's still low, his potassium's still low, and his protein's not doing good. I mean, I would cater. I started when we were allowed to visit him. I'm not only sneaking in medication, I'm cooking his food, and I'm cooking his food specific to what his labs are showing. So his protein's low. He ate more meat. I mean, we brought him steaks, taco meat, like you name it. I went to the health food stores. I got him protein drinks. He was drinking 3 and 4 protein drinks a day, protein bars. What else was I mean, I was bringing you, I mean, literally every other day I was going. Those people, it's a little privately owned shop in town called Southern Nutrition. I would walk in there and I'm like, okay, this is what he's got. What can you give me? He needs something high in sodium and high in potassium. And they would just fill me up with stuff and I bring it to him and he'd eat it. Because I think like I said to you, the other part the big part in this, in people surviving this is when you are sick, your body is being taxed. You need to eat. You know, he went, like I said, he went from 215 pounds of pretty lean muscle to literally he came home at what, 178, and you wasted away. You were like skin and bone.
Yeah.
So the dietary portion of this, I can guarantee you nobody's looking at that, not one person. And had I not factored into that too, I mean, at one point in time, his doctors were like, your labs are looking really good. And
Yeah.
I don't know why.
So about 10 days into the hospital stay, after the remdesivir, steroids just finished, the doc came in and I asked the doc how my labs are looking, and he looked at me wide-eyed. He said, your labs are looking awesome. They're fabulous. And it's almost like he was in awe over that. And I mean, he obviously couldn't understand that. I mean, from my perspective, he couldn't understand that. And I didn't want to tell him why I was feeling better. You know, my labs are getting better, and because we're working it from the inside, right? So he says, yeah, I think I can have you out of here in a week. Well, it didn't happen in a week, but it just I was getting better as every day went by. And I think a lot of it was because I was no longer on that remdesivir. I would 100% put it down that the remdesivir was taking me down more so than making me feel better.
Wow. How many days of ivermectin were you on?
You started it. We kept him on it a long time. I will be honest with you.
It was 5 days, so it was probably
We kept you on. We kept you on it even after you got out of the hospital.
Yeah,
I
but
bet
started
he was
about the 13th.
He was probably on it a month.
I'm still on it. I take it once a week.
Yeah, I mean, but he was on it like every day.
Yeah.
And he takes it
5
prophylactically
days
now.
is usually, yeah. Yeah, I take it once a week, and every single person I know has the Omicron or whatever, and I've been around. I don't. And I don't do anything. Huh?
The other thing I will tell you, so at that point in time, the only thing he had to do now was wean off his oxygen. I mean, that was the biggest part. So we literally weaned him off his oxygen too. That was our nightly phone calls then were, because he could talk and breathe then. So our nightly phone calls every night at 5 o'clock, we called it his oxygen challenge. we would wean him off his oxygen at night. And then finally he was on enough oxygen. Respiratory switched him over from the high flow nasal cannula to the simple nasal cannula. And he did his activity challenges
Well,
and came home.
let me tell you how that happened. So I was on a high flow nasal cannula, and the oxygen content and the volume of oxygen they can give you in that is pretty high. And so I was certainly on the upper level of that, and also utilizing a non-rebreather to help augment the amount of oxygen saturation that I needed to have to maintain a 90%. So my wife says, you know, you're oxygenating at 96% now with your high flow nasal cannula and your non-rebreather. Why don't you just cut out the non-rebreather and just stay on the nasal cannula, high flow nasal cannula? So I did. I just turned off the oxygen and the non-rebreather, and I put it up on my bedside table, and I didn't use it no more. And I noticed that I was maintaining my oxygen saturation better. But now remember, this is going into my ivermectin administration and my vitamins. And so I noticed that my sats are getting better. And she says, you know, the next day we talked, and she says, you know what, you should reach over there on your high flow nasal cannula knobs and start turning them down. And I'm thinking, you know what, wait, you know, this is a respiratory therapy deal. You're telling me to look at, she says, take me a picture of that machine so I can take a look at it. So I took a picture of it, and she says, just turn this knob down and turn that knob down. And so, you know.
Did you follow Nurse Ratchet's directions?
I certainly did. Yeah. So she started weaning me off these this high flow nasal cannula, and you know, lo and behold, I'm starting to sat better, and saturate better. And so, you know, it went on day in, day out. Every day that clicked by, she would make me reduce my oxygen requirements on this high flow nasal cannula. Make a long story short, 7th or 8th day into it.
Now this is like hospital day 15, really,
Yeah.
or probably 18, more like it.
Yeah. And she said, just cut that sugar right down. And yeah, I don't, she could probably tell you better about it, but they came in. I think she had a discussion with one of the RNs at the front desk.
His nurse called me and said, hey, we haven't talked in a while, and I know you guys are both nurses. She said, but because they're supposed to give you daily updates. And basically he told them not to because of the lingo that we can understand, and I was reading and stuff. So his nurse called me and said, hey, I wanted to give you an update just because we haven't done so in a while. And I basically said to her, I said, her name was Brittany. I said, Brittany, I said, so at what point in time is he going to come home? And she said, well, he has to get, you know, off his oxygen. And I said, I know. I said, we've been doing that every night. I said, at what point in time is respiratory going to take over and do it? And she was amazed at what had gone on. Like, none of the staff had really known what we were doing. Clearly respiratory didn't know what we were doing. And so I don't know what she did, whether she went to her head nurse, but I will tell you, after our conversation, and it was, I mean, it was a good conversation. Like, she thought it was a pretty amazing thing that him and I were doing, because as nurses on that floor, for whatever reason, and I don't understand it, I've been out of the critical care units too long to know, evidently they're not allowed to titrate oxygen. When I worked the critical care units, we were allowed to titrate oxygen. So that's how I kind of knew what to do. So now it's just, I don't know whether that's a COVID thing, whether that's a new thing, but now just respiratory therapists are allowed to titrate oxygen.
Well, RT was coming in there, and RT would, you know, evaluate my status, and they would cut me down. But when I say cut me down in reference to volume of oxygen, they would go very little at a time. And it just wasn't enough to challenge me. And
So
when
the
I would
challenging is good for recovery? Is that right?
You
I
have-
don't understand the concept here.
That was just kind of the term that we used. It was just weaning him off oxygen, but what I called it was his oxygen challenge. So we had bought him a little pulse oximeter that tells him his oxygen concentration. And again, we snuck that into the hospital so he knew where he was at. And so we would turn his oxygen on. We would call it his oxygen challenge, and we would turn it down, and he would watch his pulse oximeter. And as long as his oxygen stayed above 90 or 92, we went with it. If it dropped lower than that, we increased his oxygen. So it was kind of a challenge to him to see how low can you get your oxygen before it's too low. And when it's too low, let's bump it up a little bit and stay there. So we were weaning him off his oxygen.
Do patients get kind of used to being on the breather so they don't challenge themselves to do it on their own?
Patients don't know to do it on their own. Like, unless somebody instructs them on how to do it. That's why I said a lot of what you're hearing from our story is so unique in that we knew
Right.
what to do. Like, a lay person would not know to do that. Like, his roommate next door, who, you know, has no medical training and his wife's at home, would be at the beck and call of respiratory to do this.
But it's
I was
almost like
wondering-
you guys created an athletic challenge almost that
Yeah.
he could focus on.
Yes.
Yeah.
And that's what I told him. It was funny because I told him this little incentives barometer, I would tell him, instead of being at the gym and doing 10 sets of 10 curls, now you do 10 sets of 10 in your incentives barometer. Like, that was his workout. He went from a gym workout to a pulmonary workout.
It's wild.
So bottom line, he after that conversation I had with his nurse, respiratory, lo and behold, showed up in his room.
Yeah, they challenged me, and when they noticed that I can maintain my sats without the high fluid nasal cannula, they took it out,
And they put him on what he's on now.
and then they put me on the standard nasal cannula now.
And
How
2
was
days
your
later, I was home.
How was
How
my
was your
recovery?
Since I see you, you're still using that. How's your recovery?
My doctor indicates that I'm in chronic respiratory failure. I do have some fibrotic changes in my right middle lobe, and he reports it's being related to COVID. So I had some damage ultimately come from the virus itself. And that's simply why I'm back onto the oxygen. If I'm sitting down and not doing anything, drinking a cup of coffee, I can oxygen saturate from 94 to 96%. That's just on room air. But the moment I stand up, my heart rate goes up. It goes over 120, and it probably go even higher. But my heart rate goes up and my sats drop, and they'll drop down into the high 80s. And so,
He's definitely oxygen dependent. He's nowhere near where he was before.
right.
The other thing is he is actually on blood pressure medicine to keep his blood pressure up. So whatever, they do think there's some kind of cardiac damage done, and he's been followed by a cardiologist, but until his breathing kind of stabilizes, they want to do a stress test on him, but they can't do the stress test because he can't breathe. But so there's definitely some cardiopulmonary long-term sequelae that I think is there. And if my gut instinct is it's not due to COVID, I think it's due to the remdesivir.
I agree.
Nobody I know that's had COVID has any of this. He's the only one I know that's had remdesivir, and he's got all of this.
And I've read these happen with remdesivir. So I had a quick medical question. I know a lot of patients get on remdesivir, which makes you retain fluid because of your kidneys, and also steroids, which makes you retain fluid. So it seems like you're double dipping on retaining fluid, which is bad. You know, what's your opinion on that?
The moment I stopped the remdesivir, like I said earlier,
Your kidneys
I
are
was seeing my kidneys seemed like they were coming back. As a matter of fact, it was showing that on my lab work as well, that my labs were stabilizing. And just over that time period after the remdesivir stopped, even the doctor was wide-eyed. He couldn't believe the amount of all my labs were coming back to where they need to be at. And but before, they were bad.
And you just stopped he was on
Dex.
dexamethasone for how long? You just stopped it a couple weeks ago.
Yeah, I did a 10-day route in the hospital. They stopped me after 10 days. My pulmonologist started me on another 30-day bout. No, I take that back. My PCM initially started me back on prednisone again. And I did that for 30 days. And then my pulmonologist started me on another 30 days after that. And yet I'm finishing up another 30-day bout of prednisone, 20 milligram doses.
My point in this is, as far as the benefits of the steroids, I think they're definitely there for the pneumonia aspect of it.
Yeah,
But to double them down with remdesivir,
right.
like you said, it's just a double whammy. But I do think the benefits of the steroids far outweigh the
Remdesivir.
benefits of remdesivir.
When I was on prednisone, I blew up like the Stay Puft Marshmallow Woman. I mean, I
Right.
was receiving so much fluid, and I'm like, if you're using that and remdesivir, I mean, you are just drowning these people.
And then the third, and I'm sure some of the people that you've talked to, the third caveat in this is if they get put on vancomycin. He was never put on vancomycin, thank God.
My aunt was,
Yeah, but the vancomycin will do your kidneys in. They're,
yeah.
you know,
I can lie to you. I mean, there was at a point in time that I was even asking the doctor to get me started on vancomycin. And I'll tell you why. It was about the third day I'm using the inspirometer, and I developed a pain in my lower right chest. And this pain was 10 of 10. Now listen, I'm an old combat guy. I know pain. I lived with pain every day. And so when I tell you 10 of 10 pain, you got to know that this pain is like putting me in the ground right now. So objectively, subjectively, that's my definition of 10 of 10 pain. It's bad. And so I was using this inspirometry, and I developed a pain in my right lower chest. And I called my wife and I told her, look, I think I just developed a spontaneous pneumothorax by using this inspirometry. Because like I said, this was a fight every day, 24 hours a day. I was doing something to make sure I keep my lungs expanded. I wasn't going to go out like this. So I fought every day. And when I was using that inspirometry, I felt like I blew a hole spontaneously in my right lower lobe. And I was having extreme pain, 10 of 10 pain. And I called the nurse, and the nurse came in. She says, I'll get a hold of your doctor. And I don't know, it's probably 2 hours before radiology finally got to me to get yeah, it felt like it was 2 hours before they got up there to take the radiology, the chest x-ray. And when they came in there, I was short with them, and I ain't gonna lie to you. And it was because of the amount of pain I was in. And, but that was the fight that I was dealing with, because I don't know where I was going with this, but it
he
was
still has COVID brain.
yeah, I still lose track of everything that's going on. I mean, there's multiple problems that
Where you have the damage, is that the same lung where you have the damage? And
Yeah.
what day was that in relation to the remdesivir treatment?
That was the day after that was, you got your last dose on Friday, I think, and that was Saturday morning.
Yeah. I mean, I was on the phone with her, and
The last person we interviewed, remember Brad had neurothorax because, after the remdesivir.
I mean, I think that's that can very well happen, because if somebody's got structural change of their lung capacity and obvious damage, pneumonia, swelling, and if somebody's fighting to breathe, they're going to do everything they can to open up their chest. And that inspirometry is a tool that is used for that. And I was doing it 10 times an hour. Every hour I was doing it for 10 times just to establish that. And I didn't start feeling better until, once I stopped using the remdesivir.
He stopped the remdesivir on a Friday. We started him on ivermectin the following Monday. And it took about 10 days. And really, it could have been sooner, but again, like I said, the stress on the hospital staff, especially the respiratory therapists throughout the nation right now, is tremendous. I think he probably could have been home. We started him on the remdesivir that Monday. He probably could have been home a week later, but he came home like 12 days later. We started him on a Monday. He came home like the Friday after that. It was like 9 days later, 10 days later. So, and even then, like, you want to talk about as far as my perspective, as far as things that he has to live with. Like he said, as long as he's sitting drinking a cup of coffee, watching a movie. He can do that without oxygen. He's on oxygen now because of the amount of conversation that we're having, the amount of talking that he's doing. So he needs that. We live out in the country. We've got a pretty long driveway. He cannot go down and check the mail without getting short of breath. His PCM is hopeful that he will be back to work. He works as a nurse also. She's hopeful that it's going to be another 6 months and he'll be back to work, which will be over. It'll be right at a year from his diagnosis if he can go back to work. Working as a nurse for as long as we have, I hope he can. If not, like I said, there's some kind of role. I think God put us through this for a reason, and I don't know what that is yet. It'll make itself apparent. It always does. But there's some kind of role that will come out of that for the two of us, for sure, for him. Whether that's in the medical field or not, I don't know. I think the biggest thing for the two of us is, telling our story. If we can help anybody out there just by hearing our story, I'm not even opposed to people contacting us. I can't tell you how many people have said, look at my labs, or I've printed out that FLCC protocol for people. I mean, I have printed that out and handed it out like I hand out water bottles at a soccer game. I mean, I think you're muted, Brad.
You don't have to do this, but if you want to throw out your email address, you can. If you don't want to do that, we could screen it for you, but it's totally up to you.
I mean, they can contact us. I don't know what to tell them.
What's the best way to get in touch with you?
Do you want to give them which one? The one that you have access to?
Yeah.
Our email address is bikergeorges, BIKERGEORGES @gmail.com.
Perfect. Yeah, no, oh man, I mean, we've learned so much, and you shared your story with our Monday night at 9 o'clock group and blew them away. And there's real important takeaways from what you have to say that I think can help people. I mean, it's beyond nobody should be getting remdesivir, which I firmly believe. It's crazy that people get remdesivir. But setting that aside, just your approach, the necessity to have some, the 10 minutes of contact, which basically gave him the will to fight. And then it's very sad, but just the idea that, a nurse in the hospital requires another, ICU nurse for many years to get medication and therapies outside the system and have to sneak it in to save her husband's life. I mean, it's unacceptable. This has to stop.
The biggest reason I snuck them in really was because I know that if I had told somebody that I'm bringing these into my husband, the answer would have been no. The 7-layer salad that you have to go through to get things approved in the medical system, even when a patient brings in prescribed medication, those have to go through pharmacy. Pharmacy has to screen them. They have to approve them. I feel for these people that try and do things the right way. And I am not by any means saying do things the wrong way. But I think there's when it comes to your family and it comes to your loved ones, I think as long as there's no harm, no foul to anybody else, you got to do what you got to do.
Yeah, agreed.
Hopefully somebody in a position of authority will see this, and it'll be an impetus for them to change these rules. The isolation is unacceptable.
The isolation is the biggest thing. The isolation, I knew about it. Like I said, it was 18 months that we had both. He worked in a clinic, so he didn't see it as much. I saw it in the inpatient setting, but the isolation, you don't think about it when you're the healthcare provider. You just follow the rules. Okay, there's only one family member allowed, or if you have COVID, there's no family members allowed, and you don't think about it. But I will tell you, being on the flip side of that, I treat my patients different. I educate my patients different. I involve family members differently. It has been eye-opening experience in that regard for me also.
We are going to, as we go forward, and as we get out of this, we have a little bit of a backlog of interviews to do. We wanted to get you done. It's what, 24 hours after, or 48 hours after you said you were able to do that, because your information is so crucially important for everybody to have. But we're looking towards maybe doing like a roundtable where people like yourselves who are, you know, we're the front lines of this effort on both sides, can share ideas with each other, and maybe that'll benefit even more people. So we'll be looking forward to doing that in the next few weeks. Thank you so much. I think we're over our hour time.
Thank you.
I want to keep this at a reasonable amount of time for people to get through. It was all extraordinarily interesting, and also practical in terms of how you can save your loved one who gets admitted into a United States hospital in 2021 America. Thank you very much for both your willingness to share your very personal story, and I remain convinced that as a result of you doing this today, we're gonna help a lot of people. Thank you so much.
You're welcome, Brad.
Our pleasure.